So we all get to the time where we turn 26, or we know someone that's turning 26. And this doesn't even matter to people that there are certain categories of people that this doesn't matter to. Okay. So if you had a parent that didn't really care about health insurance and they were always healthy, they say, okay, I don't need health insurance. That means that you were not on their plan, and so you didn't get kicked off. So you have no idea what I'm talking about. But there are others that have been on your parents' plan because your parents maybe had a good job where their job was providing health care or health insurance for them, and you were on that plan. Now, when you turn 26, some allow you to stay on until you're 31, but when you turn 26, guess what? You get booted out either that month you turn 26, the end of the month, or the end of the year. Okay. And so basically, when that happens, it opens up a special enrollment for you. Okay. Now, with special enrollment, you got to have proof that you turned 26, and you got to have a letter from either the insurance company on the company letterhead, or a letter from the employer saying, hey, we can no longer cover so and so. They turned 26, so they got booted off the plan. They're not going to say booted off, but you know how that is. So basically, if you're 25 and you know your birthday is coming up, just keep in mind that you're going to have a qualifying life event. And that qualifying life event is, hey, I'm getting kicked off my parents' plan. Whether it's health insurance or life insurance, the same thing is going to happen. Okay. And so you definitely want to know who your doctor is, your providers are going to be. Some people have their parents still doing everything for them even when they turn 26. Okay, so one of the things you need to know is your deadline. Hey, when am I going to get kicked off your plan? Hey, mom, dad, when I'm getting kicked off your plan? Because I know I'm 25 and my birthday's in a few months. When am I going to be getting kicked off? So you need to know that date. The reason you need to know that date is because once you get kicked off, especially if it's not between November and January, then that means you only have within 60 days to get another plan. Okay. And if you miss that deadline, then you've got to wait until open enrollment. And once open enrollment starts, you have to wait until January for your plan to start. Okay. So you definitely want to keep that in mind. When you turn 26, you need to know when you're getting kicked off of your parents' plan. And then within 60 days from the date you get kicked off, you gotta enroll another plan, and you're gonna have to know how to choose a plan. Okay. And so some 26 years old are very smart and intelligent, and some still act like little children. They want their parents to do everything, so they don't know anything about health insurance, how it works. So if you're 26, and you probably need to start at the beginning about how to choose these plans. You don't choose plans based on how much it costs unless you're struggling. Now, you may qualify for a tax credit that could lower the amount that you pay. Like if you got your little job or something, you may be making some money. We can find out how much you make, and maybe you don't have to pay the full amount for the plan that you desire. Okay. You also need to know who your providers are. Which doctors do you see? Okay. What are their phone numbers? What's the address? Because if you have a good agent, your agent is going to do some research for you. Now, if you're a good student, you're going to do it yourself. Okay. And so you need to know whether you want an HMO or PPO or EPO, what kind of plan you want to go with. Because if you're on your parents' plan, which is a lot of times from an employer, which is called a group plan, you're not going to find an individual and family plan that works the way theirs does. Okay. So you're going to have to know how to choose a good plan, okay, for you. Okay. Now, if your parents are paying for it and they don't care how much it costs, great. You still need to know how to choose a plan, or you or your parents. Okay. And you got to stop. At some point, you got to stop depending on your parents to do everything for you. Okay. So you got to have all these things in place. Don't wait to the last minute because of these deadlines. Now, most companies, health insurance companies, when you turn 26, they're gonna want to know. You're gonna have proof that you turned 26. Okay. Some may need a copy of your driver's license or a copy of your birth certificate, and then proof that you got kicked off of a plan. Okay. Now, if you're 25 and you have not even had health insurance, when you turn 26, you can't get a plan because you did not lose coverage as a result of turning 26. So when you turn 26, the only way that you have a qualifying life event where you can be able to enroll in a plan is if you were already in a plan and you got kicked off. Now, if you never had a plan before that, then this does not even apply to you. You got to wait to open enrollment. All right. And so um if you got to know when deadlines are, you got to know where you go for emergency, like which urgent cares are near you, whether or not, I mean, it's just some homework you got to do. Okay. So you got to find out your deadline. You need a list of your doctors and prescriptions and stuff, because if you don't handle this on your own, and you have a good health insurance agent, they're going to ask you all of these questions. Okay. You got to choose a plan based on how you use care. Like, emergent, how often do you go to the doctor? How often do you get checkups? You should be getting one at least once a year. And that one, most health insurance are required to pay for your preventative, like your pap smear, mammogram, your blood work, your yearly blood work. Um, so I say don't wait till the last minute. Some people wait till the last minute. They only got a couple days left for their special enrollment, because you're supposed to do it within 60 days. All right. Some people wait to day 58. Okay. And now they're rushed. They don't have time to compare plans. So they're stressed out. So you need to be thinking ahead on this. If you have a child that's going to turn 26, a niece, nephew, whatever, grandchild, tell them, hey, let Victoria help you. Okay. But no, this is for really for education purposes only. You know, it varies. I mean, coverage varies by state and by situation, okay? But yeah, but for the most part, when you turn 26, that's a qualifying life event, okay? It opens up a special enrollment for you to be able um to apply for health insurance, because normally after open enrollment season, no one can apply for health insurance. The only way you can apply is if you get a new job and they're offering health insurance, or um, you have a qualifying life event such as marriage, divorce, turning 26. Those are some of the life events that allow you to go ahead and enroll in a plan. But there's a time frame to that, which is within 60 days. So don't wait to the last minute, especially if you need to do some research, know how these plans work, and know how to choose a plan. You don't want to wait to the last minute. So if you know someone turning 26, or you're turning 26, you have a daughter, son, or whatever, send them this video and so that they can be ready. And if you want the checklist, just comment checklist in the comments, and I'll send you the checklist for turning 26. Okay. Happy learning.